3, 2, 1. TikTok Live number 61. We're now live. I'm recording this. I'm putting this up on the podcast YouTube channel later. And I give a shout out to the top 5 listeners to the podcast in the caption of that. So kudos to you if you stay on the whole thing. But yeah, dude, I got the fan on in the background because it's really starting to get warm here in New York. I mean, really warm is relative. You know, warm for New York, but not warm for like Georgia. But yeah, my AC went out. Jesus, 4 days ago, and 2 days ago it was 88 in my apartment. I mean, I'm sweating my balls off in here trying to fall asleep at night. Oh, I can't. I'm going to the hospital tired. Yeah, my arms sticking to my sides with sweat after workouts and stuff. But yeah, literally 88 degrees, 89 degrees in my apartment. I have a thermometer over there. It's like my alarm clock. My alarm clock's like a thermometer. It's yeah, it's like it's just a lot going on, man. You know? But anyway, happy Monday. Actually, Cinco de Mayo. So cheers to that. Yeah, it's literally Cinco de Mayo. Should I crack open a beer? If someone wants me to crack open a beer, I'm gonna crack open a beer. You let me know. I still gotta work out though, guys. I do. I still gotta work out. I could go on for about it's 7:22. I could go on for like 20, 25 minutes. I could give you a solid 20, 25 minutes. Let's do that. But yeah, happy Cinco de Mayo. All right, let's get after it. MJ said healthcare studies major for dental school. No, I mean, if you're interested in healthcare studies, do it. Do what you're interested in. Just make sure while you're majoring in something, maybe minor in that at least, to make sure that you hit all the prerequisites for dental school, medical school. It's basically pre-med classes, get the DAT in, and then you can apply to dental school. All right? You don't have to go overboard with all dental and teeth stuff, right? You don't have to major in teeth to go to dental school. You can, major in something that you're interested in and something you're passionate about, and then minor in those studies, because it's really only like 1 to 2 years of college that you really need to get the material in prior to the DAT, right? Like those prerequisites. So just something to consider, all right, MJ? M said thermometer as an alarm. That's a new one. Yeah, dude, my alarm is a thermometer. It shows the temperature. I got it from Target. Like, that was a long time ago. I got it before I went into college. I was looking for like an alarm to wake me up in the mornings, and it's separate from my phone. I prefer separate, right? And yeah, it's a thermometer. It shows the temperature on it, which is pretty sweet. I've been using this thing since, let's see, I started college in 2012. So it's 13 years old. Still kicking it over there. I've had to change the battery like 7 times, 10 times, but yeah, it's pretty good. I said, do you ever use a stethoscope? Yeah, we do once in a while, especially prior to sedations. We want to assess someone's airway, their lungs, how their breathing's going, especially if they have, severe asthma, or they've had a recent upper respiratory infection or a virus or something. Yeah, we use stethoscopes. If they have a recent upper respiratory infection or something, personally, I'm not doing the sedation. I'm not going to risk having a laryngospasm during my sedation. No, I got to be focused on the sedation, making sure the patient's comfortable, and the surgery itself. I'm not taking any risks. If you had an upper respiratory infection in the last month, I'm not doing it. Most might do like 2 to 3 weeks. Look, I want patient safety to be put number one. That's my number one priority here. So I'm not going to be messing around with that. Just my thoughts. C. Benji said, yo, what's up? How's your Sunday going? Well, it's Monday now. But what's up, C. Benji? How are we doing? It's my Monday's going pretty good. We had our cases and everything. I got my last. Here's pretty cool. This last weekend was my last weekend on second call of residency. So the rest of residency, which is like 4 to 6 weeks, I don't have any more call on weekends. Thank God. I hate taking a hospital call. Call in the office for the clinic. That's whatever. Sure. Easy. But hospital call is like, it's a lot of work. You get a lot of calls. You get a lot of pages. Not really a fan, especially on the weekend, especially at night during the week, like right now, second call. Not really a fan of that. And yeah, it's something you got to deal with. But yeah, Monday was good. I also did my last presentation because I have 2 more weeks left of Monday morning rounds presentation. We present cases and stuff to review every Monday morning. And we this morning was my resistance pulling this style from the tube. Get it out, man. Make sure it's twisted and unlocked correctly first, please. Yeah. So, all right. Let's move on. But yeah, Monday's going good. See, Benji, how's your Monday going? Let me know. Rolex King, do you eat red meat? Yeah, I eat red meat. Are you kidding me? Red meat is like my favorite thing to eat in the world besides rainbow cookies. And brownies. Oh, man, nice like fudge brownies. Fudge brownies are great. And rainbow cookies. Love them. Yeah. So let's see what we got here. Rolex King. Do you have a Rolex? How many Rolexes do you have? And what Rolexes do you have? I'm curious. Rolex King. Christian Hamner said, do you want to open up your own clinic? No. Look, opening up your own clinic in New York with the taxes out here in 2025 is extremely difficult. And like 90 something percent of small businesses die. Yeah, an oral surgery practice would be a small business, but it would be the highest chance of it being successful. But even at that, I don't like, nobody likes an uphill battle. You know what I mean? But yeah, I also want mentorship. So I plan on buying into a practice. And that's, I'm going to be working in a multi-practice as an associate for the next 2 years. And my goal is to buy into that. I'm going to have to prove my worth as both a surgeon and as a partner. So I'm trying to take hold of the marketing side and keep working on that and go from there. But so open up my own practice? No, I want to buy into one and help build from my understanding and experience, combining with another's expert experience, and go from there. Tony, do you want to take trauma call after residency? Look, I would, but a lot of these hospitals got to pay their surgeons for taking call there. You know what I mean? And it's got to be reasonable. It's got to make sense. So we will see. I do like trauma. Trauma's generally a lot of fun. Christian Hamner, not to be personal, but please tell me what you got on your DAT. I got a 21 academic average. I got a 22 on the PAT. I got a 26 on Orgo, 22 on Gen Chem, 20 or 21 on Bio, and then reading and math. I don't know, but they weren't great. So I think they were like both 19s or something. 19, 20. I don't know. That's what I got on the DAT. So, yeah, Riley, I'm not an officer for any clubs in undergrad. Will this impact my dental school application? I don't know. I don't think so. I mean, clubs aren't like the end all be all. You got to think about your DAT, the school you came from, your degree, your grades, your GPA. That's all more important than that. Luke, incoming D1, said, did you meal prep in dental school? No. I didn't meal prep in dental school. I would just buy dinners that are pre-made already. Just heat up in the microwave. That's just still what I use. And I make my lunch every day. So morning cereal. Right now this year, I'm doing like a breakfast bar, the RX bars, because it's like the most healthy, the least amount of ingredients, and oatmeal in the mornings. I'll have a banana around between 10 and 12 o'clock for like a late morning snack because you'll get hungry about then. I do grilled chicken salad. I mix up the dressings for lunch, and then I have microwavable meals. Right now I'm using Nate Meals. That's a company that I'm using. I get meals from that are really healthy, and they're not in a plastic container. They're in a paper container. So, yeah, things are going well as far as meals go, I think. M. Brads. Do they teach much about ergonomics in practice during school? Yeah, they teach us a bit. I would say, it's big on, I would say I would say that they teach us about ergonomics. It's really big on holding your posture, working with the loops to make sure that you're holding up straight. You're not leaning in and bending and crunching in your back to look in at the, looking at the patient or the mouth of the tooth or the prep that you did. I don't even wear loops. I don't wear loops in residency. I just like blank loops, and they're basically just safety glasses, but I have a light on it, which helps me out immensely. So I don't know. That's what I do right now. I'm not a big loops person, at least at this time. You know what I mean? And Brad's just got the #1 gifter badge. All right. There we go, and Brad. So Riley, what made you choose dental school over medical school? Well, look at the medical doctors. Very few, most of them are not, I don't know. They're not, I shadowed a couple medical doctors, and they did amazing things, but they all worked for hospitals, so they were just employees. That severely affects autonomy. And then, like making your own schedule, going home, taking your kids to soccer practice and whatnot. And then they weren't really happy. A lot of them weren't happy. And the ones that did on their own practices sold. The dentists, a lot of them have since sold. But dentists, they were all a lot happier than the medical doctors. So Jesus Christ. Anyway, so yeah, I don't know. The dentist that God, it's funny when you're on second calls, you got messages coming in that you got to respond to. That's the only reason why I'm taking the pauses. Sorry about that. Anyway, some funny stuff that's going on. Jesus Christ. Okay, moving on. Yeah, dentistry seems to be a lot more favorable to quality of life than the medical side of healthcare. No, you could definitely win an argument saying that a lot of the medical specialties, some of them are much more favorable. Sure. I would say a good majority of them, I don't know, not the greatest quality of life. And I'm all about quality of life. You want to afford a good living, right? But it's about the living, not the working. Correct me if I'm wrong. Is it about the living or about the working? Because I'm all about working to live, not living to work. And it seems like a lot of people around here, especially, like in certain career paths, so it's very type A, go, go, go. You could be a go, 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 but get your priorities right. You could spend your life in the hospital all day long, your entire life. And maybe they'll write a book about you, but maybe they won't. And if they don't, it's like you're gone. And you didn't enjoy your life. I want to die happy. I don't want to have any regrets. And I think that's a big part of it. You got to think ahead a little bit. And I don't think a lot of people are. Don't do everything that they just tell you to do in school. Think about your life for once and think forward and make sure that you're going in the right direction, because you don't want to end up in a place where you're regretting. Regretting is a waste of time. It brings down your whole mood. It could cause depression. And that's something to consider. If you know you're going in the wrong direction, you're walking into a hole, maybe you don't want to walk into that. You know what I mean? MJ, do you think switching from healthcare studies to finance to guarantee a job if I don't get accepted? You can do whatever you want, man. I mean, it sounds like you're thinking about this. I think you're going in the right direction, and you're thinking both rather than either or. I like that. I like that you're thinking that. I'm not saying do that and not the other thing. I'm thinking you need to follow what you're most passionate about, what you're most interested in, what will make you excited to learn about things. You're getting there. You're getting there. You know what I mean? The real Hemo said, what GPA and DAT? GPA was right around a 3.6. I got a 3.8 from Stevens and a 3.4 from NYU Polytechnic Institute of Engineering and Stevens Institute of Technology. And that averaged to about a 3.6. DAT was DAT was 22 academic average. No, I'm sorry, 22 PAT, sorry, and 21 academic average. And Brad said, I'm getting my doctorate in OT and starting a consulting business about ergonomics and dentistry. Do it. Maybe, make some nice devices. Do it. Riley followed the live creator. Thanks, Riley. And Brad's followed the live creator. Thanks, M. Brad's. I appreciate that. And yeah, hey, I mean, there's so many gaps to infiltrate in dentistry. There's so much that you can make money off of. There's so much that you could benefit the profession in. That's really what I'm all about. I really want to create. I have 2 side LLCs right now. I'm all about benefiting the profession. I think if you can benefit others, you benefit everything. Everything gets better. And you might make some money doing it. But I just want to see things get better. You know what I mean? Mark Y, when did you take the CBSE exam? I took it 3 times. I studied for it 2 of those 3 times. I took it once without studying after D1 year. I took it a second time after D2 year, studying about 3 months for it. And then I took it a third time in the middle of D3 year. I only got about a month studying for it that time, and I got a higher score. So, that's one. Drew, how are you feeling now that residency is almost over? Any regrets? I'm not there yet. I still have 4 weeks left. They may keep me around another 2 weeks, so that's 4 to 6 weeks left. And I have a lot to do. I have a lot to do still. I have 9 cuts left of orthognathics. I've done everything else: trauma, pathology, cancer, reconstruction, all of that. It's orthognathics that I need left to graduate, to wrap it up. I'm at 9 cuts. It's May 5th, Cinco de Mayo, and 9 cuts. It's May 5th, and I have 9 cuts left. And it's extremely frustrating. I can't tell you how many cases got rescheduled or pushed back this year. And it's been extremely disheartening, very disappointing that you set something up. It takes months to prepare, and then something happens that pushes it back. And it's not for something, if it's something that needs to get pushed back, okay, I get it. They got to close this gap here, this gap there. They got to level the line a little bit better. But if it's something that's just kind of inconsiderate, that's a punch in the, it's not great. So anyway, and Brad, as a dentist, would you find that helpful? I feel like there's such a need to improve quality of life. Quality of life, more like, do you work to live or do you live to work? That's a very important thing, okay? And yeah, I mean, ergonomics are great, but I mean, dentists didn't have to see 30, 40, 50, 60 patients a day 30 years ago. They didn't. Why do they have to now? And how many patients are they going to have to see just to make a living in 30 years? That's my concern. Because what direction are we going? Look at where we came from. It's not great. What direction are we going in? I think we need to adjust the course quite a bit. Just my thoughts. Mark, do you recommend taking it that early? Do people usually wait till D3, D4 to take? I would not wait until just D3, D4. I would take it to get an idea of what the heck this test is that you're studying for. Because let me let you know a little secret. The CBSE is a lot different from any other exam you've taken in dental school. Okay, you understand? You should get an idea of what that test is before you really start studying for it. Because I can guarantee it's going to change a little bit after you take it one time. Okay, so take it earlier rather than later. You don't have to take it like before D1 year or during D1 year. No, that's not what I'm saying. But maybe after D1 year, middle of D2 year, start to get a plan going to take that exam and what you're going to do to study for it, okay? And Brad said, so many dental professionals are in pain from workplace setup. That is true. But guess what? Disability insurance, when you get injured, doesn't even practice injuries of the back. It doesn't even cover injuries of the back. So why are we even getting malpractice when the majority of workplace injuries that puts dentists out of work are back placing? And so aren't you buying disability insurance to cover whatever that 1 in 1,000, 1 in 1,000,000 things is that puts you out of business? And I don't know. Like, it's disability insurance. If you get disabled from something from dentistry, your disability insurance should cover that. And these insurance plans aren't covering back issues. I think that's ridiculous. We got to do away with insurance companies. I mean, that is a scam. That is such a scam, dude. Armani Duraku. Were you one of the top dogs in your class? We weren't ranked. So I don't know. Mark, do most residencies pay in OS? Yes. Oral surgery residencies pay. GPR residencies generally pay. It's those two. Many pediatric residencies pay. Some don't. Okay. L, what do I need to bring for an externship, doc, that makes externships look prepared to you? You could bring the medical thing. You could bring your what's it called? I forgot. I don't have it out, but a pen light. Make sure you have. I mean, a pen light's probably the biggest thing, honestly. Drew Van Vliet, got any summer plans following residency? Yeah, going to be traveling. I would really like to hit Ireland, London, Scotland. That's a 2-week plan. I think my dad's doing a family trip to Costa Rica that I might get in on. But yeah, I'd really like to travel a little bit, see the London, England, the UK territories, some old Viking lands. I don't know. I find that stuff interesting, you know. Big Dick asked, have you ever killed anyone? Nate, no, I haven't killed anyone. What do you mean? L, what do I need to bring for the extra ship? Just got it. Good. Elia, do you have any advice to step 1? Oh, study hard. What do you got? You got boot camp now. You have first aid. You got UWorld. You got Amboss. Hey, maybe it'll help, but if you listen to the podcast we did, CBSE dissection, that helps with the CBSE, and the CBSE is a short version of step 1, so that might help. CBSE dissection. Look that up on YouTube, podcast. Hey, it might help. Miguel Marquez, follow the live creator. Thanks, Miguel. All right, friends, I'm going to take one more question, and I'm going to sign off. I got to go and work out and get dinner. It's starting to get late. It's 7:40 here. Got to get ready and get in for tomorrow. Drew Van Vliet, like the live. Thanks, Drew. One more question, friends. Let's hit it. Guys, by the way, top 5 listeners that listen to the whole podcast, whoever listened, the top 5 longest listeners on the podcast, I'm giving you guys a shout out, and I'll be putting you up in the caption of podcast, YouTube. Noelia, follow the live here. Thanks. M. Brad said, thanks for the talk. You got it. Sam Simple said, something fine. I don't know. Mark Y, as an incoming student, what's your best advice to start dental school and specialize? Yeah, just focus on dental school first. Focus on efficient and effective studying, okay? Effective studying is obviously getting higher grades, CBA, but efficient studying is maintaining those high grades, but working less and less, studying less and less, okay? Because when you get in dental school, you're going to be having, sometimes you get 3 exams all on the same day, and you have to manage studying for all those exams accordingly. So it's great when you can get good grades, but study less to maintain those good grades, okay? That's very important. All right. Armani Duraku, I respect these lives a lot and your page as a whole, especially with all you have going on. Mad respect. Armani, thanks for the I really appreciate your kind words. Thank you, friend. Nicholas Rodriguez, how do you feel about Anki? Anki's good, but I think you need a little bit more when you get to UWorld. You'll see that. And user 9634, what made you want to become a doctor? I want to help people. I wanted to work with other people, and that's why I do lives. I like working with other people, answering questions, connecting, seeing how I can benefit your life, so Apple user, thoughts on private practice OMFS? I think it's the best thing in the world. I think private practice is much better because if you're your own boss, you can focus more on the whole system and process of treating the patient. We will see. Tunla said, how was your transition from dental school to first year of residency? How capable were you? Capability was not an issue. It was just getting used to the culture. You understand that? You know what I mean? The culture. The culture of the residency is probably the most important thing because it'll determine whether you're excited and motivated to go in every single day. Are you enthused? Are you have an interest and passion for surgery and oral surgery and dentistry, but how do you get influenced by those around you, your environment around you, and how does that make you a better surgeon, right? And I think that's the biggest thing because it allows you to maximize or not maximize your time of residency. Something to think about, food for thought, and it goes for dental school as well. All right, friends, I got to sign out. I got to go get a workout in. Monday night, Cinco de Mayo. Happy Cinco de Mayo. Monday, yes, Cinco de Mayo. Thanks to everyone for coming on. I'm gonna be signing off now. I gotta go hit I gotta go get our exercise in. And top 5 listeners to this, it shows me. So I'm gonna be recording that and giving you guys a shout out in the podcast in the caption. All right, friends. Thanks so much for coming on. Love you guys, my podcast family. Thank you. You have a good night. All right. Let's make it a strong week. It's only Monday. All right. Let's go get off here.